Joanna.
Hi.
I'm going to do an assessment of your eyes, your nose, your mouth, your ears, and your lungs and your heart, okay?
Okay.
You okay with that?
Yeah.
Alright, so I wanted to talk to you about the test we did with to check your distance vision, which was the Snelling test, and that was 2020. We also checked your vision for nearsightedness, which was the Rosenbaum test, and we were checking for, and the test that was testing your optic nerve number 2, which is your vision, your cranial nerve, which is your optic nerve, okay? And I just wanted to take a look at your eyelashes, your eyebrows. Your eyebrows are thick and dark brown. Your eyelashes are thick and dark brown as well. They don't turn in, they're out and normal. So I want to take a look at your conjunctiva is pink and normal. Your sclera is white, and your iris is brown and round. They're both equal, and your pupils are round. I'm just going to take a look at your pupils to see if they react to light. Right, your pupils are equal and reacted to light bilaterally. I also want to check your ocular motor nerve, which is the cranial nerve number 3, and that's going to check the movement, how you move your eyes, okay? So I'm just going to have you look at my pen and just follow it with both eyes. Alright, great. And then I just want to also check your lacrimal ducts and sacs. Is there any pressure or pain when I push here on both sides? And the lacrimal sacs and lacrimal ducts are here. There's no pain, no pressure, no swelling. I also want to check the inside of your eye, if that's okay, with the ophthalmoscope, okay? And we're checking for your cranial nerve number 2 as well, the vision. Alright, so I'm going to have you just look straight behind me, okay, while I'm looking at the inside of your eye. Okay, I'm going to move in closer so I can see your eye a little better, okay? Okay, as I'm looking inside of your eye, I can see your optic disc. Your optic disc looks really light in color, like almost a white, creamy color. Your blood vessels in your eye are dark red and a little one. They look a little bit light. One looks lighter and smaller, and one looks darker and red. And that's the difference between arterioles and venules in your eyes. I did not see any evidence of, or did not note any crossing in the vessels. I did not note any presence of retinal hemorrhages. Right. The next thing I want to check is your ears. I just want to take a look at both of your ears. Your ears, the first thing I'm looking at and touching is your auricle. They look normal. The skin on them looks normal and consistent with the rest of the body. Is there any pain here when I press on the back of your ear, which is the mastoid area?
No.
Is there any pain when I push here or in the front?
No.
No. All right. And the next thing I want to check is your the inside of your ear to check your tympanic membrane. Okay. So just look ahead. I'm going to take a look in your eye. I said eye, didn't I? Yeah. Sorry. I meant ear. Alright, so So taking a look inside your ear, and I can see your tympanic membrane looks grayish, pearly, and it does not look like swollen or any of that. The cone of light is present. The partensia and the par flaccida is noted in the ear. Sorry. And check your other ear. Alright, ear tympanic membrane is grayish white. There's no evidence of bulging or redness or swelling. And all structures were noted in your left ear as well. I will also wanted to check your peripheral vision, which I forgot about. So I'm going to have you put your hand over your eye like this. I'm going to put my hand over my eye like this, and you're going to see my fingers moving like this. And when you can see them, you say now, okay?
No. 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 No.
Right. Do that with the other eye as well. This is checking for peripheral vision by confrontation, okay?
No. No. No.
Good. So, so I also want to check, we're going to go back to your ears. I'm going to do a Weber test on you, which is, it's using this tuning fork, and I'm going to hit it against my hand. It's going to make a noise. I'm going to hold it on the top of your head, and you're going to tell me if you can hear the sound in both ears or just one ear, okay?
Both.
Both? Okay, great. Now I'm going to go behind your ear and place this on the back of your ear, and I want you to tell me how long you can hear it. So when it stops, when you're not able to hear it anymore, I want you to say now. Okay, so. Can you hear it here? Tell me when it stops.
No.
All right.
No.
So what we were looking for with that test is bone conduction, like how you can hear as far as when your bone's being conducted, and your air conduction of hearing as well. And the air conduction was greater than the bone conduction with a ratio of 2 to 1. So now I'm going to do a whisper test. And I'm going to have you hold your ear that I'm not speaking into, and I want you to tell me what I said in this ear, okay? Good. Alright, and then I'm going to do that to the next ear. I want you to hold that other ear.
I hate football.
Good. Alright, and we were testing your cranial nerve 8, which is the acoustic nerve, okay, with those tests. The next test the next thing I want to look at is your nose, okay? So I'm just going to take a peek on the outside of your nose. The skin on your nose is consistent with the rest of your body. There's no lesions on your nose. Is there any pain when I push on your nose at all?
No.
Are you able to breathe out of both of your nostrils right now?
Yeah.
Okay. So both of your nostrils are patent. I just want to take a look inside of your nose, look at your septum. If you could just tilt your head back for me. All right. Your septum is midline and there's no deviation within your septum at all. Both of your nares are symmetrical and both are patent. The next cranial nerve that I want to test is your olfactory nerve, which is the cranial nerve number 1, and that's to test for smell, okay? So I'm going to have you close your eyes, and I want you to hold the nostril on the left side. I'm going to hold something under your nose, and you need to, and I just need you to tell me what it is as far as the smell of it, okay? Coffee? Good. And then I want you to hold the other side of your nose, and I'm going to test a different smell. And I want you to tell me what this smell is.
Alcohol?
Alcohol. That's right. Perfect. All right. So the next thing I want to take a look at is your lips, your teeth, your tongue, and your cheeks, your inside of your mouth, okay? So your lips right now, they look pretty hydrated. They're pink in color. They're symmetrical to your face on both sides. Smile for me. You have a symmetrical smile, which is great. I want you to open your mouth. I'm going to look at your teeth. Say ah. Good. Stick your tongue out. Open your mouth wider. Stick your tongue out and say ah. Good. Perfect. I want you to move your tongue from side to side for me. Good. Lift your tongue up to the roof of your mouth. Perfect. All right. So your uvula is midline, and when you said ah, I could see it. Perfect. And then the inside of your mouth looks hydrated and pink. That's good signs of hydration. And underneath your tongue, I could see some vasculature, which looked, which is normal for that area. I also want to see how you swallow. Just go ahead and give me a good swallow. Good, perfect. So what we were looking at as far as the tongue movement is the hypoglossal nerve, which is the cranial nerve number 12, and that was the tongue movement. That's the cranial nerve that's responsible for that. And then the cranial nerves we didn't really do, or we kind of talked about, which is swallowing, which is the cranial nerve 9 and the cranial nerve 10, the glossopharyngeal and the vagus nerves, which are responsible for swallowing, speech, and gag reflex. We're not going to gag you, but those are what they're responsible for. All right, and the next thing I wanted to check would be your lungs. Do you have any problems with your lungs?
No.
No? Any breathing problems at all right now?
I have asthma.
You have asthma? Okay. Do you feel like you're wheezing right now?
A little bit.
Okay. So we're going to just check. I'm going to check here to, actually I'm going to just touch your lungs just to see if I feel anything abnormal, okay? Everything looks normal right now. Your chest is rising symmetrically when you breathe in. You're not having any respiratory distress right now. I don't see any pulling in your in the areas where we would see you having a difficult time breathing, okay? So I don't see any masses or lesions on your chest wall either. I'm just going to text for vibration, and I want you to say 99 as I touch your chest, okay?
99, 99, 99, 99, 99, 99,
Perfect. All right, and then I would like to do a diaphragmatic excursion on you. And for this one, I need you to just have your legs hanging over the bed, the side of the bed over that way. And what I'm gonna do is have you inhale as much air as you can and then hold it in, okay? Okay, so right there, go ahead and breathe. All right, perfect. And then I'm going to have you take a big deep breath and then breathe all your air out. Breathe all your air out and hold it. All right, so there's a distance of about, I'm going to say about an inch and a half between where this is how far your diaphragm moves when you inhale and exhale. And that's called the diaphragmatic excursion. And is normally 3 to 6 centimeters. And I'm also going to palpate, which is just, I want to touch just to see if I can hear or feel any abnormalities here. All right, perfect. I'm just going to take a listen to your lungs as well. And so when I put my stethoscope on your back, just take a nice deep breath in, okay? Go ahead and breathe. Perfect. Sorry, I got these wrong ones. Okay, go ahead and breathe. Perfect. Your lungs sound clear, actually, considering that you feel like you're not, getting enough air, and that you feel like you might be having some wheezing, but your lungs actually sound clear. Go ahead and turn around, and I want to listen to the front side of your lung sounds, okay? And just lay back, Norm. Just relax and breathe while I put my stethoscope on, okay? Perfect. So in the front part of your lungs as well, that's the anterior part. I did not hear any wheezing or crackles or any of that. So your lungs sound clear, both anterior and posteriorly. What I also want to check now is your heart. Is that okay?
Yeah.
So I'm going to take a listen to your heart, and the first thing I'm going to listen for is the pulmonic area of your heart, okay? So that is going to be the second intercostal space of the right side, or the left side, sorry. One, two. I hear a normal S1 and S2 sound. I'll go over here. 1, 2. This is the aortic area that I'm listening to. And hear the normal S1, S2 sound. The next thing I want to listen to is called the Erbs Point, and it's the third intercostal space right next to the sternal area. The sound of the Erbs Point is a little bit louder than the area above that. I can hear the normal S1, S2 sound. And then I also want to listen to the fourth and fifth areas as well, the tricuspid area. And as I move down to the fourth and fifth intercostal space on the left side, I can hear your heart a little louder as I move down. And I still hear the normal S1 and S2 sounds. Perfect. All right, so I want to check your pulses. So I'm just going to touch here just to feel. So what I'm checking here is your temporal pulse, which I can feel, and it's equal on both sides. All right. The next one I want to touch is your brachial pulse here, and that's in both arms. Perfect. All right, and then the next thing I want to check is your radial pulses. Your radial pulses are equal, and they're equal and easily palpable, and I can actually kind of see them pulsing a little bit there. So I also want to check your pulses in your feet as well. I'm not going to be able to feel the ones in your legs as well, just because you're wearing these jeans. But I'm going to check the your pulses in your pedal pulses is what it is, and that's your pulses in your feet. So I do feel pulses in both feet, and they are equal. And that's the end of our assessment. Okay. Thank you so much. Okay.
Thank you.
Bye.